Welcome! What is haematology and what does a haematologist do? Haematology is simply the study of blood. It involves diagnosing and treating patients who have disorders of the blood or bone marrow. Blood consists of 4 basic components: plasma, red blood cells, also called RBCs, white blood cells, also known as WBCs, and platelets. Plasma consists of water, sugar, protein, fat, and electrolytes. It carries antibodies in the blood that fights off infection. Plasma also helps regulate body temperature and carry waste products to the liver and kidney, where these are metabolized or secreted. RBCs, or red blood cells, are donut-shaped cells made by the bone marrow that help transport oxygen and nutrients to different organs and return carbon dioxide back to the lungs. White blood cells, also known as WBCs, only constitute 1% of our blood. These help fight off infections and are further subdivided into neutrophils and other cells such as B lymphocytes and T lymphocytes. Finally, platelets are small cell fragments. These help clot blood, preventing it from leaking out at sites of injury. As you can imagine, problems with any of these cells can lead to grave clinical consequences. A haematologist, therefore, specializes in the diagnosis and management of several benign and malignant disorders of the cells just described, in children, adults, and even in pregnancy. Some of these disorders include leukemia, lymphoma, myeloma, and venous thromboembolism. Haematologists also have additional expertise in blood transfusion and stem cell transplants. 2 common blood tests that haematologists perform and interpret include a full blood count, also called a complete blood count, and a peripheral blood smear. The full blood count shows the number and types of cells in your blood. It looks like this. A haematologist might also perform a peripheral blood smear by looking at individual cells under a microscope. Changes in morphology and numbers of these cells can indicate a hematological disorder. The US News and World Report issues yearly rankings of the best hospitals in the United States. This year, the top 10 hospitals providing the best cancer treatment include the University of Texas MD Anderson Cancer Center, Memorial Sloan Kettering Cancer Center, and Mayo Clinic. The field of haematology is really important. When there is something wrong in our blood, our health deteriorates. Did you know that 53 people daily are diagnosed with blood cancer globally? Blood cancer afflicts people of all ages. In 2016, a 7-month-old boy was one of the youngest patients ever to be diagnosed with an aggressive form of Burkitt leukemia. Unfortunately, there are no screening tools to prevent blood cancer. Most of us likely know of someone, perhaps even close to us, who has a blood disorder. In the next few videos, we will talk more about specific disorders. See you then!